Hello, my name is Natalia Gaona-Schreier. I'm going to be performing a head-to-toe assessment in compliance for Journal 8 assignment for Purdue University Global for the assignment made by Dr. Grove. My patient is Ellen Schreier. Do you agree with this video?
Yes.
Okay, so let's get started. I feel like I need to put it a little higher. So I'm going to start doing the review of systems as I go down with my assessment. So I'm going to start by inspecting the patient's head. And while I do that, I'm going to ask the patient if he had any history of head traumas, any migraines, any dizziness, any blurred vision, any ringing in the ears, any history of strokes, any history of high blood pressure, any family history of dizziness, strokes, blood pressure, any history of tumors or anything in your brain, any problem with vision problems, any hearing problems, any throat problems, any thyroid problems, any past medical history of anything. Do you take any medications at home?
No.
Do you have any allergies to medications?
No.
Do you have any hospitalizations?
Nope.
Any surgeries?
No.
You live at home with your wife. He has 2 children. He lives in a comfortable home. He works as a chiropractor, and he doesn't feel sadness and he doesn't have any history of anxiety or depression. He doesn't have any suicidal thoughts. He doesn't complain of any chest pain or history of heart problems, no history of any lung problems, no history of diabetes, hypothyroidism or hyperthyroidism. He doesn't have any stomach problems. He doesn't have any, I already said, lung problems. He doesn't have, he has never required any blood transfusions. Again, he doesn't have any allergies to medications. He doesn't have basically no past medical history of any conditions. As well, like his family is, father is healthy, mother is healthy, sisters and siblings are healthy. Nobody has any past medical history or family history of any medical problems. Moving like that, so I'm going to start with my inspection of his head. He has a normal cephalic midline head. It appears that he had good hair distributions. I don't see any obvious lesions or masses in his head. So I'm going to move forward to inspect his scalp and look for any lesions, any masses, or any deformities on his head. And he doesn't have any history of traumas, any tenderness, and he doesn't report any tenderness to his head. So I like to go to a down approach. So as I go down, I will want to assess his ears being midline, free of lesions or any moles or any wounds or tumors. I will as well palpate his ear for any tender spots or anything like that. As I go down, I will ask the patient if he has any problems with his hearing, and he states no. And so I will go ahead and inspect his ears, how to do his, and so his tympanic membrane is fairly wide. I see the light. I don't see any swelling or any redness. He has yellow wax, which is normal in normal quantities. I don't see I can actually visualize his tympanic membrane. And in the outer ear is pink, dry, and free of lesions or swelling. As I go to the other ear, I will perform the same exam, and I will be looking at his tympanic membrane, which is visualize his pearly white. I'm pulling his ear up and back, and I'm seeing the cone light reflex, and his ear canal is with mild waxy, um, with mild wax with no obstruction, and his outer ear is pink, dry, free of lesions or exudates. Moving forward, I'm gonna look at his eyebrows, are midline, um, free of lesions. I'm gonna ask the patient if he can raise his eyebrows for me. And you raise your eyebrows, and you close your eyes tight, and you try to close them tight, and tight. So his muscles are good, intact. I'm gonna also, as I'm in his eyes, I'm gonna, sorry. So I'm gonna look at his pupils and his light reflex, and his eyes are aligned in an appropriate way. He doesn't have any strabismus or any deviations of his eyes. I'm gonna also look at the light accommodation and all my cranial nerves 3, 4, and 6 as we did in previous chapters. So I'm gonna quickly do it again. I'm gonna shine the light, and his pupils are constricting and accommodating on the other eye. I'm gonna ask the patient to focus his eyes on my pen light, and then back into the wall. Look at the wall, straight back, and his pupils are dilating and constricting accordingly. Now I'm gonna ask the patient to follow my pen light. And my patient's eyes are perla. I didn't see any nystagmus. They are properly aligned. His pupils are about 1 millimeter, and his scleras are wide, free. I don't see any exudates. As I'm in his eyes, I'm as well gonna look at his conjunctiva, which is light pink and moist. Then I'm gonna move down to his nose, which is on inspection is free of lesions. I don't see any sunburns or any moles or papules that I will be concerned of. I will move forward and palpate his nose, looking for any tender spots or any lumps. I'm gonna check for patency, have the patient take a deep breath, and then again, and patient is breathing with ease. Then moving forward, I'm gonna go ahead and evaluate his nose for patency, and I see both turbinates and everything is moist and pink. I don't see any lumps or exudate in his nose. At this point, I will probably evaluate as well his olfactory cranial nerve number 1. Then I'll move down to his mouth. His mouth is free of lesions. It's pink and moist. I don't see too much of a dryness that could lead me to dehydration of the patient or anemia. Then I'm gonna ask if I had a tongue blade. I have a tongue blade? No, I don't have a tongue blade. But if I had a tongue blade, pretend. I know. Oh, my husband is giving input. I'm sorry. So I will have the tongue blade. I will open the patient's mouth and look for good dentation, no obvious cavities. Lift your tongue, please. Up, tongue up. Has good dentitions, and his conjunctiva, his bottom of his tongue is pink and moist. And now I'm gonna ask you to say say Then his uvula is midline and is raising appropriately. Hypoglossal cranial nerve. Now, while I'm still in his face, I'm gonna assess for Sorry.
Just keep going and I can cut it out after.
How do you call those?
What?
Lymph nodes. I'm sorry. I'm going to be assessing for lymph nodes. So we have preauricular and non-palpable, post-auricular, non-palpable, submandibular, non-palpable, submental, non-palpable, anterior cervical, non-palpable, posterior cervical, non-palpable, subclavicular, not palpable, infraclavicular, non-palpable. I'm gonna ask the patient to turn this, and deep cervical, non-palpable, deep cervical again, non-palpable. So bilateral, all bilaterals, all the lymph nodes are non-palpable, which is a good thing. As I am still here, I'm gonna check his trachea for midline. And I'm gonna ask the patient to swallow, and his thyroid is raising appropriately. Then I'll probably go behind the patient's neck and assess thyroid for any nodules or lumps or tenderness or enlargement. And his thyroid is appropriate, it's normal. I don't see any lumps or any enlargement of his thyroid. Now, while I'm here as well, I'm gonna use my stethoscope for my left my hammer, reflex hammer at the office, but I will put this up. I'm gonna start checking my patient's reflex. So I'm gonna do triceps and then biceps. That's not what I'm supposed to. You're exaggerating. And their brisk and radialis. Oops. Biceps. Triceps and brachioradialis. And then I'll move forward. Can you dangle your legs? Go back a little. Hang your legs. And then I'll do his patellar. Okay, so all his reflexes are nice and brisk like 2+, and patient, so all his reflexes are good. Now I'm gonna ask the patient to squeeze my hands, and he has good strength. Now to the side, good strength, up, back, push back, push back. Okay, so he has good strength on his upper extremities. Now I'm gonna check his strength. Can you push back? My hand. There you go. About in the next one. Okay, good. So he has good strength in all extremities. I'm gonna ask the patient to get a stand up and walk to me. Walk towards me. Again, turn around. Okay. I'm gonna ask you to close your eyes. And he has good balance. Can sit down. Now I'm gonna do the sensation test. So, before moving from the head, actually, I have to do the whisper test to check for hearing. So I'll be occluding the one of each ear at a time, and I'm gonna whisper something to you. Okay?
Mm-hmm. Yeah.
99?
99.
Okay. So, sorry, my husband has earphones. So then I'm gonna do peripheral vision as well. I forgot to do that. So I want you to focus on my nose and tell me when you see my fingers.
No. No. No.
Okay. You have to keep your eyes on my, sit up straight. Get your hands in there. Focus here.
No. No.
Okay. Perfect. So his hearing is intact bilaterally. So then I am gonna move down to his breathing. His chest has good contour bilaterally. I don't see enlargement or being asymmetrical. I don't see any barrel chest. The diameter is appropriate. Patient is breathing with ease without the use of any accessory muscles. And on inspection, I will have the patient without a shirt, and I'll be looking for its skin being dry and free of any lesions, lumps, or evidence of nevi, anteriorly and posteriorly. So because we're not really doing a skin, I'm gonna move forward and percuss. Finding resonant sounds on all lung fields, except for when we have dullness on his liver. Maybe I'm gonna just have the patient lie down right now. Maybe if I move this here, perfect. I guess I'm gonna keep it there. It's better. So again, I'm gonna do have all resonant sounds. Now I'm gonna move forward to assess lung sounds anteriorly. The patient will be taking a deep breath as I put my stethoscope in. And patient lung sounds are clear, and I don't see any rails or any adventitious lung sounds present on his auscultation. Next, I am gonna, while he's lying there, I'm gonna do my JVDs. So I will have the patient look there, and I'll look for mild pulsations, which I see it there. So and then I'll be looking for his lance marks. I have the wrong one here. And I have it in metric, okay. About 5 centimeters. So he's I don't see any enlarged JVDs or anything like that, and they're pulsating normally. While I'm there, I'll just feel his carotid pulse one at a time, and it's nice and bounding, but I don't feel any thrills or whooshing sounds. I will be doing the same thing on the next one. And then while he's there, I'm gonna assess for radial pulses for a full minute. I'll look at the clock. Both pulses are plus pounding in a good rate and rhythm. And we have heart rate of 65 and respiration of 16. As I was doing that, I was counting respirations. So I'll move forward with my cardiac assessment. I will be looking for PMI. I can actually feel pretty good here, and it's consistent with the heart rate of 65. Now I'm going to move forward to do capillary refills, which I see less than 2 seconds bilaterally. Good. And finally, I'm going to palpate and looking for any tender spots in his chest. And I will go ahead and check my aortic. This one is 2, pulmonic, herbs, tricuspid, and mitral. So patient cardiac assessment is normal. I did took blood pressure and weighted the patient. Patient has a normal BMI of 25, I'm sorry. And patient's blood pressure was 120/80. I move forward to the abdominal cavity. His abdomen is flat, free of lesions, with even distribution of hair. His umbilicus is midline and appropriate to his body. Patient is breathing with ease. The patient denies having any problems with his stomach, no pain or tenderness, normal bowel habits, and following a balanced diet. Now, following after the inspection, I'm gonna go ahead and auscultate, and I will auscultate all 4 quadrants. Good bowel sounds. Good vowel sounds intact in all quadrants. I will do peritoneal irritation by a rebound tenderness. Any tenderness? Any pain? Okay. I will ask the patient to, no, I'll do it. I'll lift his leg and push down. Any pain?
No.
Okay. So a patient is negative for peritoneal irritation or possible appendicitis. We have bowel sounds. And now I'm going to percuss for liver span. I have the mark there. And I will be measuring. About 6 centimeters with a normal liver span. And I'm going to be percussing for those sounds. I'm going to look for the spleen. And it's not audible. It's not localized. And then I'm going to ask the patient to take a deep breath. Now. And I'll look for his liver, and it should be non-tender. And not palpable. Well, it's like barely palpable, the non-tender. So he has a normal liver span. His spleen is not enlarged and not found. And now I'm gonna do a deep palpation of his abdomen, looking for any masses or tender spots. Light palpation, and then deep palpation. and his abdomen is soft, non-tender, free of masses. Now I am gonna move. I'm gonna ask the patient if he can sit in the opposite side of the bed, so I can do the anterior part of his back. No, not there, right here, facing by the wall. And I move that because I have to do 30 minutes. Hurry up. And I'm gonna be assessing his skin for any lesions again, or knee, abnormal nevi. I'm gonna go ahead and percuss his lung sounds. And I have all resonant sounds. And then I will lung expansion. I'll sit up straight. I'll take a deep breath. It has good lung expansion. And then I'll just take a deep breath. A deep breath. Take a deep breath. Take a deep breath.
What could happen?
Oh my gosh. And then I am gonna look for kidney CVA tenderness. It's negative. Okay, so what else I'm missing? I did come back to the bed. So so we're not assessing GU system. His musculoskeletal is free of pain or tenderness. His spine is, I will be checking his spine for any misalignments and or kyphosis, lordosis, or scoliosis. And his spine is aligned, free of any lesions or any tumors or any tender spot, and the patient denies having any back injuries or any back pain or any problems with his back. He also, with GU system, the patient doesn't have any frequency burning to urinate or any history of any prostate problems. I think all his cranial nerves 1 to 12 were intact. The only thing I have missing will be doing the, if you can sit forward, will be doing his eye assessment, and I'll be, hold on. And can you cover one of your eyes and read the bottom line?
LTFPH.
Good. And then do the other one.
LTFPH.
Do the other one again. Do it the other way.
HPFTL.
Okay. So patient is has vision of 20/20 bilaterally. And so we have a healthy patient with a normal physical exam. All his systems were intact and appropriate and negative. This concludes my head to toe examination.